Today concludes the first working week of Brain Injury Awareness Month. It's a good time for us to look back to see how far we have come and how far we still need to go to address the many issues facing brain injury survivors and their families. A good place for us to start is a report issued to the governor of New York State in 1986 entitled Head Injuries in New York State, a report to the governor. Here is what the report, authored by the New York State Department of Health, in conjunction with the New York State Traumatic Brain Injury Services Council, which I now am honored to chair, reported. And I quote, "Head injuries that occurred in an instant have produced a lifetime of disappointment, anger, and frustration for thousands of New Yorkers. When victims and their families seek assistance in resolving the problems that result from head injury, they find that in many cases, no help is available." The report found there was no coordination of services in New York State, that New York State had no defined state policies when it came to working with traumatic brain injury survivors and their families, that there was no comprehensive network of care or support available to survivors or their families. The next year, in 1987, a new report was issued by the Federal Interagency Head Injury Task Force that echoed the findings that were made in New York State. And again, I quote, "There are no words to express the fear, anguish, and despair of TBI victims and their families. The problems resulting from severe impairment of a family member are compounded by the frustrations of trying to work within medical, legal, and social systems that for the most part are not equipped to deal with either the immediate or long-term consequences of TBI. Indeed, many patients and their families find that the present system discourages efforts towards self-sufficiency and provides no support for the family as a unit." It took 10 more years before the United States Congress enacted the Traumatic Brain Injury Act of 1986, whose goals and aims were to conduct research into the identification of effective strategies for preventing traumatic brain injury, for implementing public information and education programs for preventing traumatic brain injury, and for broadcasting awareness about the public health consequences of TBI, in providing technical assistance, either directly or through grants and contracts, to public or nonprofit entities for the planning, development, and operation of projects to reduce the incidence of traumatic brain injury, and presenting an annual report to Congress that describes the incidence and prevalence of traumatic brain injury within the United States. 16 years later, in 2012, with the assistance of one of these federal grants, New York State again examined the issues confronting persons with a brain injury and their families, and not surprisingly, they found nothing changed. Here were the recommendations issued in 2012. Enhance public knowledge of TBI treatment and prevention. Improve availability and access to community-based TBI services. Enhance TBI provider training, diagnosis, and treatment. Maximize educational and vocational opportunities for traumatic brain injury survivors. Address the need for accessible and affordable housing. So now we are in the year 2021, 35 years after the first report issued in New York State to the governor, and the same problems and issues still exist. Each year, over 3.5 million Americans will sustain some form of brain trauma, and many will live with lifelong physical, cognitive, emotional, and behavioral consequences. Isn't it time, my friends, we stop talking and start doing? Isn't it time as a nation we address the issues of the silent epidemic? Isn't it time we support the work and recommendations of the Brain Injury Association of America to support our walking wounded? These are questions that indeed we have to ponder. But it's not enough to ponder and talk about these issues. It's time that we take action. Thank you for listening to me this week, and I look forward to speaking with you again next week on another edition of the Brain Injury Insider.